Welcome to the information session for the Master of Science in Radiologic and Imaging Sciences at California State University, Dominguez Hills. My name is Keith Otterberg, and I'm the Director of Marketing for the College of Extended and International Education at CSUDH, and I'll be your host. This webinar is being recorded and will be available on our website and on social media platforms shortly after today's session. To begin, feel free to download the program information kit for details about the program and additional resources that will be covered in the webinar. The address is bit.ly/CSUDH-MSRIS-info kit. We've provided a link in the chat for those who are participating live, and it will also be available via a follow-up email to attendees as well as on our website. Before we jump in, I'd like to review the Zoom controls. This session is being presented in webinar format, so you don't need to worry about your microphone or camera. However, we want you to participate. Please help us address your questions by using the Q&A button at the bottom of your screen if you're joining us from the Zoom desktop app or web browser, or in the top right of your screen if you're on a mobile device. Once you click the Q&A button, a dialog box will open up, allowing you to type your question. Please ask your questions in the Q&A panel rather than in the chat panel. In the chat panel, we will be providing links and other information. Our marketing staff members, Stephanie Bukian and Anissa Barton-Thompson, will be standing by to assist you. We'll be answering those questions at the end of the session, although you may find that your question has been answered during the course of the presentation. That said, let's take a look at today's agenda. We'll begin by meeting Dr. Elwin Tilson, the Program Coordinator and Professor of Radiologic and Imaging Sciences at CSUDH. He will discuss the current professional outlook and introduce you to the program via an overview of benefits, expectations, and course details. Then we'll go over how to apply and address your questions in the Q&A session. We'll also have a survey at the end of this webinar, and we'd love to get your feedback so that we can make our future events even better. If you're on social media, please use the hashtag CSUDHExtendedEd or use the tag @CSUDHExtendedEd. So Dr. Tilson, let's take it away.
Thank you very much, Keith. As Keith said, I am Elwin Tilson, and I am the coordinator for Radiologic and Imaging Sciences at CSU Dominguez Hills. I've been a radiographer since 1969, so I've been around a long time. I have 10 years of full-time clinical practice before I decided to go into education and became a faculty member. However, even after I became a faculty member, I still was involved in clinical practice between 2 and 4 days a month, primarily in the trauma area. I have a very extensive background in the profession. I have served on numerous boards of directors. I've held elected positions. I've been the president of an international society. I've also published about 75 peer-reviewed articles in journals, and I've done about 75 peer-reviewed presentations at professional meetings. Plus, I've written and published 2 books. On the academic side, I've been a program director, a division chair, a coordinator, and a dean of faculty. The other full-time faculty in the program is Dr. Gary Syed. And Gary Syed has a background in nuclear medicine, which is what he did his undergraduate degree in. And then he went on and earned a PhD in medical radiation physics. But apparently he didn't quite learn his lesson, because then he went on and earned another doctoral degree in higher education administration. Additionally, excuse me, Dr. Syed is a Fulbright scholar. And if you're not familiar with the Fulbright scholarship, it's kind of like winning the Emmy Award for college professors. It's very prestigious, it's very rare, and you really have to be, internationally known to get the kind of thing that he did. So that's Dr. Syed's academic background. He also has an extensive background in publishing and in doing presentations and in serving on boards of directors of many organizations over years and years and years. Both Dr. Syed and I, as well as our part-time faculty, really see ourselves as dedicated professionals who are student-centered and who really want to have student success. In other words, what we do is we see ourselves as people who are here to help mentor fellow professionals to become the new leaders of the profession. That way, we improve the lives of the individuals who come through the program, and we also improve the quality of the profession. What is radiologic and imaging sciences? Well, for most people who are not, who are in the profession, they think of themselves as their discipline. So they say, I'm a radiographer, I'm a sonographer, I'm a dosimetrist, and things like that. And they don't really think about that they're all part of a much larger profession, radiologic and imaging sciences. What the definition of radiologic and imaging sciences is it includes all medical imaging and radiation and oncology disciplines. That's the simple definition. And it includes radiography, sonography, radiation therapy in all of its various sundry situations, MRI, nuclear medicine, dosimetry, cardiovascular, and PACS administrators. So for anybody who's in any of those disciplines, this is the degree to get ahead professionally. So if you want to move ahead in the profession, this is one way to do it. And also, you have to keep in mind that this degree is designed to increase your professional value in two ways. One is that employers see individuals with the master's degree as being somebody who they want to invest in because they believe that you will bring value to their organization, and they would give opportunities to individuals with master's degrees that they wouldn't give to other people. And it also improves the profession itself, which then comes back to help all of us. When we look at the outlook for RIS, it's kind of interesting. Right now, and anybody who's in clinical practice right now knows this all too well, we have a manpower shortage, or a man-person shortage, I guess would be a better description. But anyway, we are short practitioners. We need people at all levels. And that is especially true for people that are educators and managers. There's a huge shortage currently, and it's only going to get worse. That's because of a number of factors, but one of them is that there's a trend in the profession to move away from the idea that we take a technically focused individual and then we stick them into a management position, or we stick them into an education position, and then they learn how to do it on the job. That model is going away. What we're moving towards is a model where we now require that individuals have formal academic training in education or management to move into the higher level positions. And that's one of the reasons that that's true is, as I said before, that master's degree is seen as a gatekeeper. It shows the employer your value. And also, when people with master's degrees in the discipline bring a lot to the table, and they're quite valuable to the organizations that hire them. Where we really see that is, as an example, in education. You have to have a master's degree for many positions in education, and we are moving towards requiring master's degrees for almost all educators at many of the educational institutions around the country. And as the profession develops and we have developed more degree level options, we're going to see more and more need for graduate level people in the profession. Also, on the management side, we see a move towards requiring graduate degrees. Recently, we did a study where we looked at every job ad in the state of California that was looking for a director of radiology or any other title that looked like a director of radiology. There's a lot of variation on that kind of stuff. And we looked at what are those people requiring? And what we found was that 50% of all the director positions require a master's degree in now. So you can see that that trend is moving in that direction. It's going to be where you won't be able to move into those areas without a graduate degree in the relatively near future. We offer both a master's degree and a graduate certificate. But first, I'm going to give you an overview of the master's degree itself. This is about real life and about preparing you to move into the areas that you really want to move into. What we find is that this degree is designed to produce the leaders of the profession. I've said that before. I will say it again, because that really is the whole point of this thing. We're trying to produce the leaders of the profession. In order to do that, students are going to be involved in an interprofessional degree, and they're going to become conversant with individuals that are not in their discipline. So if they are a radiographer, they can talk to a sonographer and understand what they do, why they do it, and the terminology they use, or a nuclear medicine technologist, or an MRI technologist, or a dosimetrist. So we will focus on that interprofessional part of it. We also give students a broad-based understanding of the basic physics and instrumentation of all of the areas. And then we have, as part of the degree, specialized track in either RIS Management or RIS Education. The degree itself is 100% online, so you don't ever have to schlep down to the university and sit in a classroom at 7 o'clock at night to sit for a class. That's not going to happen. What we do have is, with online, we see all of our courses are asynchronous, and that means that they're not set at a particular time or date. So if you work 3 to 11 and you wanted to log in at 1 o'clock in the morning and work on your class work, that's fine. If you want to log in at 6 o'clock in the morning, that's fine. If you want to log in on your lunch hour during the day, that's fine too. So asynchronous classes allow you to do the work whenever you want to do it. Now, what is that work? In the courses, every week we have requirements that we require the students to do. There's reading assignments, there's projects. You will do a lot of work, teamwork with other students in the cohort. And you have to get that kind of stuff done. And it takes about 8 to 12 hours a week of your time to do the coursework for the program. Now, there are some weeks where it's a little more than that, and some weeks where it's a little less than that. Some of you may be asking the question, "Oh, that sounds like a lot. Do these people actually hold jobs?" And the answer is yes. Almost every single student we've ever had in the program has a full-time job, and they're full-time students at the same time. I'm not going to lie to you. It's not easy, but it's 1 year, 12 months, and you're done. And students do it all the time, and they succeed, and then they go on. So that's what the program looks like. So what are the admissions requirements? They're actually pretty simple. The admission requirements for the program are that you have to have a baccalaureate degree in any discipline whatsoever. So if you happen to have a bachelor's degree in Peruvian underwater basket weaving, actually that'll work. As long as the degree comes from an accredited university, that's all that matters. It has to be a 4-year degree from an accredited university. You also have to have a minimum of an undergraduate GPA of 2.5, and you have to hold national certification in one of the RIS disciplines, and I'm not going to go through that list. You can look at the specific certifications there and look at it, or you have to hold a state or national license, which, because we sometimes have students from other countries, they don't have the same type of certifications we do, but they get a license in radiography or sonography or MRI or radiation therapy or vascular technology or dosimetry or PACS administration. That would suffice also. So I would note, though, that with the admission criteria, if you're saying, "Oh, okay, I'm qualified," if you're qualified and you're interested, I would urge you to apply sooner rather than later, because we fill the program on a first qualified, first admitted basis. And once the seats are filled, and we won't take any more, we won't admit other students. So I urge you to look at that and to apply sooner rather than later. We also offer a postgraduate certificate program. In a postgraduate certificate program, we actually offer two of them, one in RIS Management and one in RIS Education. And these certificate programs are 12 semester units, which is the same as 12 semester hours long. The certificate programs are designed for individuals who either already have a master's degree but need an additional skill set, or somebody who, for whatever reason, is not ready to do a master's or doesn't want to do a master's, but wants the additional skill set. And so it takes 1 year part-time to complete the certificate program. Now, one thing of note is that all of the courses that are in the certificate program, those very same courses are part of the master's degree also. So if you're in a certificate or the master's and you're in one of the RIS Management or RIS Education tracks, you'll be sitting in the classroom with people who are also in the certificate or the other. They're exactly the same courses. So the certificate is not a gateway into the master's degree, because the courses are the same and the admission criteria are exactly the same to get in the certificate as it is to get into the master's degree program. When we look at the master's degree, there are three large groups of types of courses that we have. One of them is the science core. And the science core is where we give students a general broad overview of all the disciplines in RIS and the basic physics and the instrumentation of all of the areas in RIS. Plus, we give information about radiology informatics, which is becoming even more important as each and every day. Then there's a group of courses that are research related, and those courses help with evidence-based practice, where we teach students how to find what is the current best practices and how do I implement it into my teaching, into my management, into my clinical practice. We also include a research-based capstone project as opposed to a thesis. We don't require a thesis in this degree. And for those of you who don't know what a thesis is, it's basically a paper that's run somewhere between 100 and 150 pages long, and you end up writing it just in the last few weeks that you're in the master's degree program. And then once you're done, it sits on a shelf and dies a slow death. We don't require that. We do require students to write up their capstone project as a publishable quality article, but you don't actually have to publish it. You just have to write the article. The third area is the track specific courses. And we have 4 courses in either RIS Education or RIS Management. And as I said, they're the very same as the courses in the certificate. And both of those include a hands-on practicum. So let's take a moment and look at some of the courses that you have in the area. When we look at the core, you'll see that's in there that what we're doing is we basically touch on the basic physics of radiation. We teach on the basic physics of magnetism. We teach the basic physics of ultrasound. Just enough so that people can understand what they're looking at. And then we talk about the individual disciplines. And finally, we have a course on informatics. And in that course, we try to move people, typically practitioners, understand PACS, but that's about all they understand about the computer systems. But there's a lot more to it. So we try to get students to understand what the health information system or the hospital information system is, how the medical record works, the electronic medical records, how PACS fit into all that, how artificial intelligence is being used in radiology and therapy. And of course, the thing that is more and more important every day, cybersecurity. Why is it important? Why do we have to pay attention to it? So those are the types of science courses that we have in the program. When we look at the research courses, fundamentally what we're doing is we first of all start out with a course that says this is how research works, and we talk a little tiny bit about statistical analysis, but just a tiny bit. And then we help students understand how to find current literature about what is best practices and what's going on, how to read it, how to implement it, and then how to use that information to help design a research project for the capstone. And then finally, to write that up in an article that is of publishing quality. And that may sound daunting to some of you, but it really is not. We walk you through every step of it. Our job is to help you graduate. So we really work very hard to make sure that you have what you need. We don't just expect you to do it just because. When we look at the management track, the courses that we take there study such things as budgets, HR, evaluations, outcomes assessment. We also have a course on what is leadership? What kind of leader are you? How do you develop becoming a leader? How do you use the skills of a leader to help you improve what you're doing in management? There's also information about how to get facilities such as CT, MRI, and sonography accredited so that you can get paid by the organizations that require that you have those facilities accredited before they'll pay you. And finally, we have a hands-on management practicum for all the students in there. And the students tell us that it's a wonderful experience. Examples of some of the things that students have done in practicum are, we've had students help develop a referring physician satisfaction survey for a facility where the referring physicians were not happy, and they figured out what the problem was and worked on how to improve that. They also, we had a student that actually helped design a CT facility installation, including a renovation, equipment purchase, shielding, the whole 10 yards. We've had students work on leadership projects. We've had students that have worked on quality management projects. So the practicum is very hands-on. It's very useful. For the education track, there you have a course where we teach about the science of teaching, what works, what doesn't work, how do you actually present things in ways that students can easily understand it and learn it. And I'll give you a hint here, it's not lectures. But anyway, we have that course. We also have a core, we then talk about in some of the courses, budgets, HR, evaluations, promotions, outcome assessments. If that sounds familiar to management, that's because it is. A manager is a manager. So even people who are managers in health, in the clinic, and managers in academic situations need a very similar skill set. What we do is we focus on the milieu. So if you're on the management side, we talk about those things as it applies to the clinical environment. If you're on the education, we talk about those things as it applies to the educational environment. We also teach educators how to get programs accredited so that students can sit for the national boards. And then we have an educational practicum that students have. And the types of processes that students have worked on in the past is they've helped develop new courses for programs. They've helped develop program assessment tools that were used to help improve the programs. They've helped write self-studies. They've written modules and presentations for medical school and residents to teach them on how to be more effective and data-driven in terms of the types of radiology and therapy procedures that they order. So those are just some examples of the types of things that students do in the projects, in the practicums. What are the graduation requirements? Again, it's fairly simple. You have to have 36 semester units to graduate. Now, you can only transfer in 9 units. So if by chance you did the certificate first, then we would only be able to transfer in 9 of those units, and then you'd have to take another course. You also have to meet all the major requirements like the capstone project and all the other things that go along with that. And finally, you have to meet the graduate writing assessment requirement. Now that particular requirement is currently on hiatus because of COVID. It's not clear at this point in time whether or not it's going to be required next year. But if it is, it's fairly easy to meet. Students don't generally have too much problem with that kind of stuff, but that's the graduation requirements. And again, the faculty see ourselves as trying to help mentor you through this process so that you get to graduation. It's a failure on our part if students don't make it to graduation, and we don't want that failure. So one of the questions we get asked, and for good reason, is how much does it cost? Well, it's $424 per unit, and that comes out to $1,272 for a course. If you look at the total cost of the program, all books, fees, tuition, it's just under $16,000. Now, that's a lot of money, but let's put it into perspective. If we look at most master's degree level programs in the United States, they run between $25,000 and $35,000. And if you were looking at a specialized program that's in high demand, like an MBA, those run anywhere from $30,000 to $45,000. So $16,000 is really quite inexpensive relative to what it costs to get a master's almost anywhere else. Now, you probably should be asking yourself, why is it so inexpensive? And there's a really simple answer to that. The faculty in this program decided that this degree is a service to the profession. And if it's a service to the profession, we need to keep the cost down as much as we possibly can so that as many individuals in the profession who want to earn a graduate degree are able to earn a graduate degree. By the way, there's more information in your information kit, which you can download about payment. Now, if you are looking at the certificate, the total cost for that's about $5,500. Another question we get all the time is about financial aid. There is some financial aid available. I'm going to talk about these three links that we have right here on Dominguez Hill's website. The first is the distant learning aid. There are a number of programs to help in terms of financial aid for distance learning, and this link has a number of them that you can look at. There are also, there's a page that has scholarships, and by scholarships, I mean, if you actually look at the list, it's so long, it's breathtaking. So there are a lot of scholarships out there. Now, a lot of them won't apply to you, but some of them will. And the link there will take you to that area. Also, in terms of scholarships, almost all the major professional societies have scholarships for people who are going back to school to get advanced degrees. So for sure, the ASRT has scholarships, the ARDMS has scholarships, the ARRT has scholarships, ASTRO for therapy people and dosimetrists have scholarships, AIRS and ACERT for educators, they have scholarships for people who are coming back to become educators. And although I couldn't find any information about it on their website, I understand that AHRA, which is the Radiology Managers Professional Organization, also has some sort of financial aid that's available. So there is financial aid out there, and these links can help you find some of it. When do you need to apply by? Okay, the deadline for applying is July 1st. I do not recommend that you wait that long, because if you do, the seats may be filled. And that's for both the master's degree and for the certificate. Typically, we recommend that students start in the fall, because then you're part of a cohort of students and you'll get to know those people and you work with them and you develop those kinds of professional bonds that actually you will probably carry through your entire professional career. You do have the option of coming in the spring semester for both the degree and the certificate, if there's any seats available. Typically, we do have 1 or 2 seats available in the spring. Not because people drop out, because we rarely ever have a student ever drop out of the program, but because of the way that it ebbs and flows in terms of that kind of stuff. So the deadline for the spring is November 1st. Now, where do you apply? There's a process in California called CalState Apply, The URL to that is in yellow there. It's the www.calstate.edu/apply. It is a statewide system that you would use to apply for it. I strongly recommend that if you're going to, before you do that, that you go to the website on Dominguez Hills website and look at a short video that we've put up there about how to navigate through CalState Apply. CalState Apply is a little confusing unless you know what you're looking for. So if you look at the video, then it's very easy to apply. So once you've applied and paid your $70 fee, then it's going to ask you, okay, what degree are you applying for? And you'll be on a search page. And that search page, if you type in RAD, or if you type in radiologic, then, but not radiology, radiologic, then the degrees will pop up. Now, do be careful that the master's degree just says the master's degree, and it doesn't say anything about education or management. If it says anything about management or education, that's a certificate program, and that's not what you probably want. So do check out that video before you apply. And again, reminding you, the seats fill up fast, so please apply soon. Because this is an online program, you need to have access to online. And the student portal, once you apply, is My CSUDH. And in that portal, you'll have access to the classes, you'll have access to the email, registration, your status, admission status, all that stuff, Zoom meetings, the whole 10 yards are all through this one access point, this My CSUDH. So that's what you're going to use once you've applied. Let's talk for just a moment. You may have had a chance to read these when they were on the carousel at the beginning, but let's talk about what the program brings. You have, first of all, the program brings opportunities. This is Christina. Christina was a clinical instructor for a sonography clinician doing sonography, working with students, wanted to become a faculty member. She was in the program. And while she was in the program, a sonography program actually reached out to her and asked her to apply. And that's quite unusual. And it's very unusual that they would ask somebody who didn't even have the master's in hand at that point in time to apply. So this degree, being in the degree, opens opportunities for people. And just an aside, we've had multiple students that have been offered promotions because they were currently in the master's degree. The degree also gives you a information set, you know, what you learn in the classroom that really can change the way that you see the profession and change what you're able to do and how you can go about doing it. Now, the curriculum is rigorous. It's 12 months long. You know, you would start in the middle of August, and then the first week of August the next year, you're done. So it's very rigorous, it's very fast, but that curriculum is really very important. This is Michelle. And what Michelle found was that after she started incorporating what she was learning, it totally changed the way that she looked at the profession and started changing the way she practiced the profession. And because of that, she's now involved in a situation where she's currently writing a major article with a fairly well-known individual who is, and it's for a major journal. So we have that curriculum that helps you do it, and it brings stuff that you can hear today and take into the classroom tomorrow. And that's the last thing, that it is real-world applications. This is Ray. Ray was a clinician who was teaching a few courses here and there for programs and wanted to become a full-time faculty member, so he came into the master's program. I happen to know some of the students that he's taught, and they always considered him to be a good teacher. But what Ray found was once he got into the master's program, that there was so much better way to teach than what he was doing. And he totally changed the way that he approached education. and he's now a full-time faculty member. And the students that have him as a faculty member say he is a great teacher, in part because he applied all the stuff that he learned in the program. So this degree is here to produce the leaders of the profession for tomorrow. And that's what we're all about. And I would like to take a moment and just thank you very much for being here and for participating. And we'd be more than happy to answer any questions that you may have.
Thank you very much, Elwin. That was a terrific presentation, terrific overview, and I think everybody's got a much better idea of what to expect in this program. We're going to take your questions now, and please ask your questions, as we said before, in the Q&A panel, and then we should be able to get to everybody. So we have a few to start with. The first one is, how many students are in the master's program in the cohort? I think since we limited, people want to know.
Right at the moment, we would take 30 students a year.
Okay.
So
how many is that? So there's 30 in the master's program, and how many in the each of the certificates?
In the certificates, that is we have to adjust that for that. But typically, we don't have very many students in the certificate because that's not what most people end up doing. When they look at what a degree brings to them, and the fact that you have to do 12 of the 36-hour units for the degree, most people end up with that. But we can take up to about 5 people a year into the certificate, each of the certificate programs.
Great. Okay. So it's very intensive in terms of the focus that each instructor can have for each student.
Yes. We know our students. We know who they are. We know where they work. We talk with them all the time. We really get to know them, and they know us. Like I said early on, we see them as fellow professionals, and we treat them as fellow professionals. So we develop that professional camaraderie.
Okay, great. The next question is about the practicum. They're asking if the hands-on practicum can be completed with their current employer, and if not, are there established sites where the practicum can be completed?
They can complete their practicum any place that they want to, that we can have that will sign a contract with us. To put a student into a facility, there has to be an agreement between the facility and the university. It's a standard process. We just have to, do the paperwork and get the signatures. But yes, you can do it where you currently work.
Okay.
And probably half of the students do that.
Okay. Somebody else is asking what the average age is, or age range of students in this program. I imagine it's quite large.
Wow, that's an interesting question. I haven't really thought about that, but I would guess probably our youngest students are probably in their late 20s, and we have students in their late 50s also. Most of the students in the program are probably between 35 and 50.
Okay. Okay. So another question is, will a student be able to sit for any advanced clinical boards after completing the master's degree?
No.
No.
This is not an entry-level program. These are not entry-level processes. There are no boards for educators. There are no boards for managers. Now, I will say that the AHRA has a certification in management, and students in the program have taken that board and have passed it for the management side. So there is something about that, but it's not specifically aimed for that.
Okay. Another question is, somebody's asking if they don't get accepted in the master's program, can they still apply for the certificate program? But I remember you saying that the exact same requirements for each. Is that correct?
If somebody is rejected because they don't meet the minimum requirements for the master's, they also will not be able to get into the certificate. If they don't get into the master's because we don't have a seat available, they could get into the certificate and then apply for the master's again the next year.
Okay. What would be the difference between this degree and a master's in healthcare administration?
That's a really good question. The difference is that when you look at a master's in healthcare administration, it's a very broad-based degree. It looks at all the aspects of healthcare administration, from all the clinical sides, all the business sides, all the stuff that people in our profession don't really need to know. When you look at what we do here, we focus in on how do you become, and we're talking about the management side, how do you become a director of radiology? What skills do you need to have to be that director of radiology? Now, having said that, I will say that employers also, once you have that master's, it opens all kinds of other doors too. So the content of the degree itself is slightly less important, but the big difference between those two degrees is that ours is very focused. And there's a study that was done a couple of years ago where they asked COOs, the operating officers for hospitals, about would they prefer to have individuals that had MBAs or healthcare administration or masters in the discipline with an emphasis on management. And what the majority of them wanted was a master's in the discipline with an emphasis on management.
And that's what this is.
Yeah, that's what this is.
Great. Okay. You didn't mention the GRE. Do students who've taken the GRE receive any preference in admissions?
No, you have my sympathies though.
Okay. And for the practicum, so this is kind of the opposite of the other question. If students are not employed, are there sites for them to get that practicum?
Absolutely. We will work with a student and find out what they're interested in doing and where they're physically located, because we have students all over the country. And we will work with them to do that. So yes, it'll take a little legwork, but that's what we do. So we're good with that.
Okay. Okay. And then somebody's asking about the admissions process after they apply to CalState and submit their transcripts. What's the next step?
Well, and it's a good thing you mentioned transcripts. That is something that students stumble on a lot. They don't quite appreciate the fact that once you've applied to CalState, you've got to send transcripts for every single institution that you've ever earned credit at as an undergraduate, all of them. And they need to do it fairly quickly because it takes a while to get them and to evaluate them. So the next step after that is that you just end up waiting. And it takes anywhere from 4 to 8 weeks to process an application. As we get closer to the deadline, it takes less time, but that's because they're very focused on it. But as an example, right now, it's taking about 6 to 8 weeks for a decision to come down because they're busy admitting students, graduate students that are in programs where the 1st of next month is the deadline, and they're focused on that right now. But that's essentially what it takes to do.
Okay. The next question is about transcripts. Somebody's asking if you need transcripts if you attended a CSU school. I'll answer that. The answer is yes, unless you attended CSUDH, then you would not need to submit transcripts. Then the next question is, Jennifer wants to know a little bit more information about the practicum. Anything else you can say about that?
Well, the practicum is designed to let you find something that you're interested in doing. And the reality is that, you know, anybody that's a manager in a clinical environment or an educator always has stuff on their desk that if they just had some help, they would like to get around to it. And the practice, that's what we have students look for. So what we find is that students typically will find a project that sounds interesting to them, and then they work with the manager in the clinical environment, or they work with the faculty in the academic environment, and they work their way through the practicum. And students tell us that practicum helps them sort of gel together and figure out how all the stuff fits together. and that it's a really good experience, and that they walk away with a tremendous amount of new information and insight to how things operate.
Terrific. Okay. Somebody's kind of trying to pick between the two disciplines in terms of management or education. Any help in helping them decide?
Yes. The reality is, and I've been affiliated with another master's program at a different university. In fact, Dr. Syed and I started that program at a different university on the East Coast some years ago. And what we found was about a quarter of the people who did the management track ended up in education, and about a quarter of the people who did the education track ended up in management. And yet they had almost no problems doing that because the skill sets are really fairly similar. So what I would suggest is, pick what you think is probably most likely, but that doesn't lock you in. So if you have the, an employer is not going to ask you what your track was. They're going to say, do you know anything about budgeting? Do you know anything about HR? Do you know anything about accreditation?
Right.
That's the kind of stuff that you're going to find.
Right. It's, yeah. What skills can you bring to me?
Yeah, it's about skills.
When do you notify students that they've been accepted? How long does that take?
Soon as their application is processed by the admissions office at Dominguez Hills. And like I said, that can take anywhere from 4 to 8 weeks, depending on how busy they are and how long it takes for the transcripts to show up.
Okay. Okay. Somebody else is asking how long the program has been around. We've been around for what, 2 years?
We are in our second cohort right now. Yes.
Right. Okay. Couple of other licensure questions. If somebody is not licensed in California, or if they're not licensed in the United States, are they still eligible for admission, or is there anything special they need to do?
I'm going to make a distinction. Licensing is a governmental process. Certification is a professional process. So what we look for is certification. So if the individual holds one of those certifications that was on that slide, in radiography, nuclear medicine, all those, that long list there, then they're eligible. If they're from a foreign country that doesn't have those types of certification processes, but they have a national thing, as an example, in England, they don't have certifications. The fact that you have the bachelor's degree in radiation sciences is your license to practice, and we would accept that.
I see. And what if that certification or license has expired?
Then they need to talk to me.
Okay. Last question, I think, is it possible to do the master's degree part-time?
Yes. Some students do choose part-time. It's not very common. But we've had students that, because of work situations or home situations, that they chose to take 2 years to finish the master's degree program. We had a couple students that ended up getting promoted into really intense jobs and had to step back a little bit from the master's program and go part-time halfway through the program so that they could do this new job and finish the master's. So yeah, you could go part-time.
When we were talking about the part-time program, somebody was asking if they could switch from full-time to part-time if that became necessary.
Sure.
Okay. Another person is asking, they've completed an X-ray program, but haven't taken the ARRT yet. Can they apply?
They can apply, but they can't start until they've passed the ARRT.
Got it. Okay. And does another master's degree?
May I just add one thing, please?
Sure.
Oh, I'm sorry. This is a CalState apply. If that individual applies and it asks, what are you certified in? And actually you're not certified yet, go ahead and indicate radiography, that you're certified in radiography. And then what we'll do is we will deal with having, making sure that you're done before you start the master's program.
Got it. Okay. And one other question is, somebody's asking if another master's degree would help in terms of admissions.
No. What we're looking for is we're looking for practitioners, and people in the profession, and that's the main criteria. So you know,
let me stop you. They actually they clarified their question. They're asking if holding the master's degree would make it easier to get promoted as compared to having years of experience.
Oh, well, historically, no, but now and in the future, absolutely. Places now are moving towards requiring, and this is coming down the road, so that you can't move outside of an entry-level position without a bachelor's degree in the future. That's coming. It'll take us a little while to get there, but it's coming. And as part of that, you can't be an educator, you can't be a manager, you can't be a leader without a graduate degree.
Okay. Last question, I believe. Somebody's asking how many students we graduated last year.
We started out with 19 students in the cohort because it was our first year. And of those 19, we graduated 17, and 2 of them are still part-time.
Okay, so no failures.
No failures.
Excellent. Okay. Well, that concludes our questions. Anything else you'd like to say in closing, Dr. Tilson? Or?
Well, I just want to compliment people on being interested in this thing. I applaud you for wanting to improve yourself and improve our profession. And I hope that you'll find that what you're looking for is something that we offer. We really do see ourselves as very student-oriented and success-oriented, and that's what we want for you.
Thank you very much, Dr. Tilson. This has been terrific. For everyone's next steps, you would need to go to calstate.edu/apply, and that's where you would apply for the program. And then if you have questions that come up after this webinar, you can email Dr. Tilson at ris@csudh.edu. So this concludes our session. We want to thank you for joining us, and we'd love to get your feedback, see if we did a good job today. If we can improve the quality of the information, that would be terrific. You can do a survey at bit.ly/CSUDH-webinar-feedback. That link will also be in an email that will be sent out to you. So don't worry if you didn't get it right now. Also connect with us on our website and on Facebook. And we'll stay in the session for a few minutes to give you a chance to jot down last-minute notes, download the information kit. And when you're ready to leave, just click the red leave button on the corner of your screen. Once again, thank you for joining us, and have a good evening.